Hi, everyone. Thank you so much for coming to the webinar today. Um, just a few intro slides to get started, and then we'll get to the discussion. So just wanted to remind everyone who we are. We're the Law and Policy Partnership. We provide the legal technical assistance in California to California communities, and it's a partnership with American Lung Association. And I wanted to give our land acknowledgement. So the Public Health Law Center is not actually located in California. We're in the Twin Cities, Minnesota. So I want to give our land acknowledgement, which is that we are located in a land that's near Bedote, where the Mississippi and Minnesota rivers meet, and which is the birthplace and center of all things for Dakota people who have stewarded the land since time immemorial. This region is also home to the Anishinaabe and other indigenous peoples from many tribal nations. Indigenous peoples have made and continue to make countless and uncounted contributions to this region through protection and stewardship of the land, air, and water, the preservation and revitalization of indigenous foodways, and demonstrating resiliency in the face of overwhelming odds. We recognize that the land the Public Health Law Center currently occupies was forcibly stolen and comes with a legacy of U.S. law and policy aimed at attempted genocide and oppression of Indigenous people, and that nonetheless, this land remains and will continue to be Indigenous land. We also recognize that connection to and stewardship of the land is important to all Native Americans, including the tribal communities in California. We believe that a fundamental part of our work is to repair and address this heavy legacy of the law and to apply ourselves to supporting California tribal communities and exercising sovereignty to improve the lives of their community members. I also just want to say that, especially in these times, where did my slide go? In these times that we are grounded in and committed to equity and health equity, and we believe that it's an innate understanding of ours that equity and justice are pivotal to impacting the social determinants of health. Lastly, we provide legal technical assistance, which means we're lawyers and policy analysts, but we're not your lawyers necessarily. But we do legal research and presentations and answer questions and things like that. But we don't do a direct representation and we don't lobby. I also want to take a quick moment to honor our colleague, Chris Johnson, who passed away in February. We've partnered with Chris over the years in his different roles, focusing on public health and tribal communities. He even partnered with us on the resources that we will share at the end of this presentation. And he was a wonderful colleague, person, and friend, and we were honored to work with him. He'll be deeply missed. So I just want to take one moment to honor his memory. Okay, without further ado then, this is the quick agenda. So first we'll have Nicole do an opening prayer. So I'm going to turn it over to her. Thank you, Nicole.
Good morning, and thank you, Natalie. Thank you, Public Health Law Center, for inviting me to this space, and ultimately thank you, Colin, and Olin, and Clinton for allowing me to occupy this space with you. As Natalie said, my name is Nicole Graham, Tosi Castillo Ano Napa. My name is Nicole Graham. I come from Murder Valley Rancheria, which is the Pomo. I'm about 2.5 hours north of San Francisco. My grandparents and parents both come from Lake County and Mendocino County, Pomo, traditionally. It is a huge honor for me to present this blessing in our very traditional way. And when you are asked to do a blessing, it is never a blessing for anyone in particular. It is always a blessing that everyone who is in this, we ask Creator, everyone in this space today, please give our speakers and panelists knowledge and give our attendees the passion and compassion to hear and listen without judgment, to understand your own boundaries in creating this knowledge, and to please honor the space that you have in participating with us. And as I always ask, Creator, please fill this space and please let the world know that we are healing and there is health and safety among us. And we ask that you be in this space with us and hear what needs to be heard and say what needs to be said. So, Yahweh, and thank you.
Thank you, Nicole. So now I'll turn it over to Olin to give us background on tribal casinos. Thanks, Olin.
Well, good morning, everyone. Um, as Natalie mentioned, my name is Olin Jones, and I'm a member of the Chickasaw Nation of Oklahoma. And when we greet our friends or relatives, we have one simple greeting in our language. It simply is Chokma. So today, I want this atmosphere, this environment that we're in, to be very friendly, open to conversation, and I can consider those who are engaged in tobacco cessation or addressing, some of the tobacco related illnesses. You are my friends. So thank you so much to the organizers of this event for including me, and it is an honor. And I also want to mention that I am the warm-up act for Clinton Isham. He's the big star here. This is like I'm like a garage band warming up for Elvis Presley. So I'm gonna I'm gonna do my very best to do a quick uh, uh, California Indian commercial gaming presentation. So I'm just gonna hit the high points, and if I say something that you want to follow up on, please place it in the questions. And if we don't get to it today, I'll get back to you on it. So I am going to try to share my screen. Whoops.
Yep, that's
There
good
we
now.
go. There we go. Sorry about that, guys. So again, thanks for being here. It's my job to do a quick, brief history of commercial tribal gaming in California. And I need to say also that the opinions and positions that I express today are solely mine, and they're not mine of my former employer, the California Office of the Attorney General, nor are any of the positions or opinions I make related to any of my clients that I have now as a tribal consultant. And if you can advance on. So California is home to 109 federally recognized tribes. And sometimes you're going to hear that number is going to be 111 tribes, because there's a couple of tribes, I believe it's Fort Mojave and Washoe. They're located on the border, and sometimes they're in the count as well. But those tribes have some of their trust land in other states, and they have trust land on the border, which comes over into California. So sometimes you'll see that number to be 111. So don't be surprised if you see that. Um, Now, the thing about being federally recognized in California or any other state, that means that tribes are sovereign nations. And the sovereignty that tribes have is legally described as being a domestic dependent. Um, and 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 I wish I had more time to explain this, but I believe a tribe's sovereignty is commensurate or maybe even exceeds a state's sovereignty. So a tribe is probably their sovereignty is limited by three things that they cannot do. They cannot create their own currency. They cannot create an armed force or a military force, and they cannot declare war at all uh, on any other state or country, which pretty much coincides with state sovereignty. But anything else, any other level of sovereignty that they want to express in terms of retailing products, creating justice systems or social service systems or programs, are limited by the amount of resources that they have, which sounds pretty much like a state. Um, there's 45 tribes in California that are currently seeking re-recognition and they were terminated or never recognized in the 1950s. And there was a time in the history of the United States where tribes were basically just as the word says, they were terminated. And now that hopefully a lot of those mistakes are being corrected. And I have a graphic I'm going to show here in a minute that shows that California's tribes are located pretty much everywhere throughout the state. And they're in highly populated areas and rural areas. And back when the reservations and rancherias in California were established, um, they were basically put out of sight, out of mind. And you'll see a huge cluster of tribes up, beginning in about the Clear Lake area, going way up north to the Oregon border. And then there's a huge cluster of tribes down in the San Diego Riverside area. And they were purposely put there way back when those areas were established for the tribes. In some cases, like the tribes in Southern California, what 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 the folks thought back then about getting them out of sight, out of mind, turned out to be a gold mine for them when you roll forward to the year 2000, when tribal gaming was legalized in California. And I'll show you a graph in a minute. So California's tribes some of them are very small, and some are as large as 5,000 members. But if you're familiar with some of the tribal populations of other tribes like Navajo or Cherokee or Choctaw, those are up in, 60, 70, 80,000 members. So some of the tribes in California, and I guess I don't have enough time to go into this, but they were subjected to a horrible genocide during the gold rush. And it was a horrible time for the tribes because the land that they occupied in California, uh, the dominant culture wanted that for what was under the earth. And so those tribal people were basically killed, and there were actually bounties put on them for the purpose of removing them from the land. There were as many before the gold rush. Some census numbers that I've been able to find indicate there was as much as 300,000 Native Americans in California. By the latter end of the gold rush, it had dwindled down to 30,000. So it was a huge genocide that occurred in California. And I'm sorry to use such a harsh word, but there's not many ways to explain that. Go to the next slide, please. So you can see by this map, it's a little bit difficult to see, but you can see where the cluster of tribes down in San Diego County and Riverside County, and then you go up north. There's a huge cluster up there, and there's some in Central California as well. But the majority of the tribal folks that are indigenous to California are, in these clustered areas. Um, and I believe if San Diego County has 18 tribes, 18 federally recognized tribes within its borders, which has the distinction of being the county with the most tribes in the United States. The numbers are small for the tribes, but the tribes are there, and they total out to be about 18. And next slide. So as a practical matter here, tribal commercial gaming is pretty new in California. It's legal. It's been legal, and we'll talk about this in a few minutes, since about the year 2000. But I want to make a strong point here that just because tribal commercial gaming was legal in California, uh, made legal in the year 2000, actually tribes had the right to game and gamble back to time immemorial. This is something that they've always had. It's not anything new to our tribal governments. They've always had this. It's just that the state legalized it on March 7th, 2000. So in California, and you probably have heard some of these stories, but tribes were exercising this sovereignty that I told you about by having the sovereign authority to open poker rooms and bingo halls on tribal lands. So they did this probably in about the the early 1980s. And we're going to go into that just a little bit more in a few minutes. Uh, but but that's how it started, and it had a happy ending, but it was a little bit rough getting to the point where it was legalized. And it was legalized in California through a constitutional change in March 7th of 2000 through a ballot process. So you can see that tribal gaming in California has been very successful. Those numbers are amazing. 12 billion in gaming revenues, and it employs more than 85,000 persons across the state. The other positive outcomes related to tribal gaming can be viewed in the local partnerships through the improvement of infrastructure. Many of the tribes contribute to police or fire services or medical response services. There's a huge number of partnerships that have been developed around tribal gaming. And I should also mention that with the onset and success of tribal gaming, another area that tribes exercise their sovereignty in is the ability to retail products like gas and tobacco. And we'll talk in a few minutes about some of the tobacco retailing that impacts Indian country. Next slide, please. As I mentioned, the pathway to all of the success that the tribes have had hasn't always been easy, and there's been a lot of political disputes and litigation around around gaming. And in the early years, California communities exercised their right to express the "not in my backyard" syndrome. So a lot of communities did not want to have tribal gaming in their communities, and they thought that it would bring crime, it would bring just levels of violence to the community, but that's been disproven. It's not. Costco or something like that. So it's probably even lower because they have better security. Some of the longstanding tensions in California around tribal gaming has been with other purveyors of gambling, and that's like the urban card rooms. And there's been tremendous friction between these groups, and there still is, and there's still at odds over internet gaming and some of these other areas of sports betting. So it is pretty unpredictable, but I'm sure we're in for an interesting time. Next slide. So there's some factors that I've just boiled it down to the very essence, reasons for the success for the expansion of tribal gaming in our state. People love to gamble, even in times of recession, depression, um, or fiscal hard times. People still love to gamble. That is a fact. Also, governments, state and federal, need money to operate, and this is something that generates the kind of funds I talked about. If you're a sovereign nation and you want to express your sovereignty, if you want to build your recognizability in the community, if you want to give your constituents the kind of programs they need, you need to have resources, and that's going to come through gaming, could possibly come through subsistence funding like tobacco or gas retailing as well. Something to remember, though, there's an important piece to this. that if you compare tribal gaming to maybe gaming that you would see in Reno or Atlantic City or Vegas, that money ends up ultimately in the hands of a few people kind of at the top of the pyramid. But tribal gaming, um, that is dispersed to the people through programs or to smaller tribes, sometimes to per capita. But the end result of tribal gaming has been to create a viability for tribal communities. It's not based in greed. It's based in providing for people's needs. And for myself, my own tribe, they provide a banking system with the resources that we have. They send our young people to college, providing they have the GPA. We have low interest loans for houses, automobiles. We have programs for medical needs. So all of the funds generated from my tribe's casinos go back to the people. So next slide, please. Just a just a quick history. I know I'm taking up too much time. Sorry, Clinton. I'll move on here. But if you want to look at history, you can search this out online too. But in the 1980s, three tribes, Cabazon, Barona, and Morongo, they began offering bingo halls and card games. And this the state of California has laws that do not allow gaming, and they define gambling as a misdemeanor and, depending on the amount, as a felony. So local law enforcement raided the Cabazon, Barona, and Morongo tribes, and especially focused on Cabazon, and they shut them down. And the case went all the way to Supreme Court. And in 1987, the tribes prevailed, and the courts held that the state had no authority over tribal gaming. Next slide, please. So even though they got a successful court decision, the Governor Wilson, who was governor at that time, would not negotiate very good gaming compacts. And a compact is the agreement between the state and the tribe and the feds that allow regulatory authority for the gaming to go forward. And the compact basically is a contract, which describes how things are going to go. But Governor Wilson would not do that, and so they decided that they were going to have to go back to the ballot. So they advanced Prop 5, and Prop 5 in California was the most expensive ballot effort in the history of our state. And actually, the tribes put up 65 million to advance it, and the gaming interests from Nevada and Vegas and Reno and Tahoe, they put up 25 million against it. But the tribes easily won the vote. And even though Prop 5 passed, the employees union registered a complaint about that, and they got the court to throw out Prop 5. And you go to the next slide, please. And the Hotel Employees and Restaurant Employees International Union versus Governor Davis held that Prop 5 was unconstitutional, and that they said it was a violation. So the tribes then came back in the year 2000 with Prop 1A, and they easily won the right to game again. So basically, it was confirmed twice that the people of California wanted tribes to be able to have the right to exercise their sovereignty through offering tribal commercial gaming. Next slide. The one thing that is always important that I emphasize is that the California Constitution now prohibits Nevada and New Jersey style casinos, but it gives federally recognized tribes exclusive gaming rights. So that means the tribes are the only ones that can have the kind of games and gambling opportunities in the state of California, as long as it's on their land. Next slide, please. Okay, we have casinos, we have tribal state class 3 gaming compacts, marvelously, hugely successful. And next slide, please. So here's some stats on the current tribes gaming operations. 62 tribes operate 65 casinos. Some of the, well, a couple of the tribes have two casinos. That's why the numbers don't sync up. $12 billion in revenues. Amazing, amazing. New casinos entered the Northern California market between 2019 and 22, and casinos now that have been around for a long time are under construction, being expanded, being renovated. So it's continually being successful. So that last slide there is related to the master settlement agreement. And some of you folks that are involved in tobacco cessation may recognize the master settlement agreement. So very quickly, I'm going to tell you why this touches Indian country. You know that every state, in 1998, 46 attorney generals across the United States started the litigation against the 4 major tobacco companies. They were successful, they prevailed, and every year the tobacco companies have to provide the various states with the funds to address some of the medical concerns caused by tobacco. Well, in the fine print of the master settlement agreement, there is something that says something like tobacco retailers that are retailing tobacco products that are made by non-participating manufacturers, Indian tribes, have to come into compliance, or we're going to stop the money coming to that state. And so that effort to get that issue under control started in about 2012, 2012, and then it concluded with some litigation that was brought through Big Sandy Rancheria v. Rob Bonta, the Attorney General in California. But essentially, the tribes are saying we don't have to participate with any state law, whether it's MSA or not. Our sovereignty protects us, and we can retail whatever we want to on or off the reservation. So to make a long story short, there's been a lot of contentiousness between the state and the tribes around tobacco. So if you're out there and you're working in this field of cessation and you mention tobacco, you have a pretty good chance of getting a cold response because of some of the contentiousness and the trouble between the state monitoring what tribes sell and how they retail it. So it still isn't really settled. There's still a lot of disagreement about that issue. So just letting you know that's possible. And I have experienced it myself. And the reason that I know about this is because I was the one that the Attorney General sent out to negotiate with the tribes about getting this worked out somehow. And there just wasn't any working it out. So it's still an issue. Clinton, I'm done.
Thank you, Olin. Go ahead, Clinton.
Okay, I'm gonna do a share screen, I think. Okay, can you guys hear me? All good?
Yes.
Well, thank you, Olin, so much. I always appreciate listening to you speak. I feel like I learn so much every time, and you explain things in a way that, like, especially I could understand things easily. And I know California really paved the way for tribal gaming and for tribal casinos throughout the U.S. And I'm in my own tribal casino right now in like Flambeau, Wisconsin. I'm Ojibwe from Wisconsin, and every time I come here, I say thank you to California before we go in here, and just thank you for the California tribes for all the work that you guys did, and it's amazing, and continue to pave the way for gaming and a lot of things that you guys do. So my name is Clinton Isham, and I work for American Nonsmokers Rights Foundation. I'm a tribal relations consultant. I apologize too. I'm in a public space right now because I've been traveling for the last couple of weeks, and I'm not at home. And so if you hear stuff, vacuum cleaner or something, I'll try to just talk louder or make sure that you guys are catching everything that I'm saying. Um, what A&R does, A&R Foundation, it's a nonprofit that's based out of Berkeley. And what they do is they just really help coalitions throughout the United States that are in the process of passing smoke-free policies. And so what you see on the screen is a map that is available on A&R's website. And this shows the number of smoke-free policies by state and by local government, city government throughout the US. And we have it updated like every 6 months or so. But as you see, there are many differences throughout the US and how smoke-free policies are passed. And the story of this map, how I share this in the presentation is, just think about everybody on this call. If you want to take a second to think about the different campaigns that you may have worked on, whether it was a smoke-free policy campaign or something else, and think about all the energy and the funding and the commitment and the time and the resources that it took for that initiative, for that campaign to get off the ground and to become successful. That's in a nutshell kind of what I do to help support with A&R Foundation throughout the U.S. And in particular, I work specifically with tribes across the U.S. in making sure that that process is being supported. Many times in commercial tobacco control, in this work, there's only like a small handful of us that may work on an entire region or may work, with all the tribes in the US, or there may be a small handful of us that works with all the tribes in California. I think a part of my message, many times on these presentations, is to try to bridge the gap, or to just make it known that tribes, they want what is best for their communities too. They, and many times, support smoke-free policies and want smoke-free casinos and smoke-free homes. And we need the same type of support and energy and time and commitment that it took for California to go smoke-free. It took for Wisconsin to go smoke-free. And so my job really is to like help bridge that gap and to show support for tribes and to make sure that tribal campaigns are as successful as possible. And many times our work with tribal communities, it's very similar to conventional programming of commercial tobacco control, say through federal systems or state funders that are doing this work within communities. Our work is very similar, meaning like we want the same things, right? We want lower smoking rates in our communities. We want lower cancer rates in our communities. And many times we achieve those through similar processes, right? We pass smoke-free policies. We raise the tobacco age limit. We put in place policies so that we can, get a grasp on some of these things, smoking related things in our communities. But our approach in this work is fundamentally different, right? in many tribal communities, we have this, long historical complex relationship with tobacco before it was commercialized. And so many times our approach in this work isn't necessarily that we want to eradicate tobacco or that we want to remove tobacco. We want an end to tobacco. That's not what a lot of tribal communities want. It's actually quite offensive to go to a tribal community and to say that, because they have a deep respect and they have a relationship with tobacco. And so many times tribal communities, the approach is more around reclaiming tobacco, reclaiming our our old tobacco seeds that was in our communities that grew there for many centuries before colonization. It's to reclaim that tobacco and to use it, to continue to use it in our communities for what its original intent was for. And that's for healing, that's for well-being, that's for connection, for Thanksgiving, for prayer, and for those types of things. All those things that tribal communities rely on and depend on. That tobacco is an important tool. It's an important thing that we use to get to that place. This is a picture. This picture is a picture of Nathan Moose. He was an advocate for the CDC for many years. Nathan Moose was a Oglala Lakota, from Oglala Nation in South Dakota, I think. And he was an advocate for smoke-free spaces, for smoke-free gaming, for safe indoor breathing spaces. He worked at a casino his whole life, or his whole adult life, and he did not smoke. He didn't smoke at all. And he ended up passing from a smoking-related illness. And he was a huge advocate for the CDC and wanted to, pass policies within tribal communities and supported those types of smoke-free breathing spaces. Why I bring this up is, of course, that we never forget Nathan Moose and his story, but Nathan's story, it's so like, it's so everybody in our tribal communities, we know somebody like Nathan Moose. We know a family member that is in our casinos that's exposed to secondhand smoke. We know somebody that has passed from cancer that is related to smoking, or that their health is impacted related to smoking. It's just so prevalent in our communities that, based on my experience working with tribes, many tribal communities are ready for this work. They're ready to pass these policies. They're ready to to do what it takes to reclaim tobacco, to eradicate commercial tobacco, and to restore the health of their communities. And so but the key is, right, the key is the approach. And what I'm here to share is like, how do we do that? How do we approach these tribes? And the biggest thing is just to listen. It's to listen to these communities in what they want. A big part of sovereignty, and I've heard this from many tribal leaders and casino leaders working with casinos on the smoke-free issue for many years, is they just don't like to be told what to do. They don't like when an organization like mine goes into their community and tells them that they have to go smoke free, right? And so I have to listen to that. I have to be careful and make sure that I'm taking, the approach that is respectful as possible, because this is a sovereign nation. They make their own decisions for their own communities. And as you've seen from Olin's presentation, they do it well. They generate billions of dollars in their communities. And so it's like, who am I to go into this community and tell them what to do or how to operate their casino differently? And so the key is just always with the approach. And there's many ways that we can do this successfully with tribes and communicate successfully with tribes. One of the ways is through data collection. This is one of the things that many tribal communities, it's something that's difficult in many tribal communities to data collection. It's difficult to administer surveys, or it's a difficult conversation to talk about data collection in many tribal communities. And so one thing that I do before I work with the community, or I work with the tribe, or I work with the state, is I try to do my own type of data collection on smoke-free gaming within a specific state. And so this work was done, I think, in 2023, and I had this in a report that I did from 2023. And it's not 100% accurate, because a lot of times to figure out like if a casino is smoke-free in California, um, I have to like cold call the casino, and it doesn't necessarily mean it's smoke-free. It's just like I'm talking to the person on the phone, and the person on the phone may or may not like tell the truth or even want to talk about it, and so I might have to call back. But the point of this is these are just some of the things that can be done within your own community if you're interested in working with tribes. Is just, one thing is figuring out how many of these casinos are smoke-free in your community, and just maybe sharing that information or using this as a tool to reach out to casinos or tribal communities in your region, in your state. um, and so this is collection from California. We contacted a total number of 97, and I know this looks different from Olin's data too, because I think this included bingo halls and gas stations. So many times a casino will have like, it's not always like about big resorts. They'll have many like satellite sites within their convenience stores or within gas stations. And so I think the total number here was collected from like bingo halls, gas stations, and casinos. And so this is just an example of cold calling casinos. I found out that 39 were smoke free, that 54 of those had some sort of policy on the floor. 51 were partially smoke free, and then I asked about the number of hotels and asked whether or not the hotels were smoke free or not. And again, the reason why it's important to just to ask these questions, this information isn't just out there on the internet, because a lot of casinos, they're not like required to to report on whether their casino or their floor is partially smoke-free or non-partially smoke-free, because casinos and tribes make their own policies, and they kind of operate within, their own systems. And so I use this information so that, for one, if I could contact casinos that are smoke-free and see if they need any type of implementation support, or if they want to celebrate them going smoke-free, or if they need signs, or if they need any type of support at all, because it's so important to try to reach out to these tribes and just to see, if they need any type of support, or if you want to send them an award, or if you want to, have your coalition work on like sending the casino a number of reviews just to support the casino and their smoke-free policy. And the other thing is, if you want to reach out to casinos that aren't smoke-free, that don't have smoke-free policies, this is a good thing that your coalition could do, that your, community could do. So you could reach out to casinos and, just see if they're interested in, any type of support for their casino to go smoke-free. And I bring this up because I've used this survey. We developed this template survey, and we've sent this out to many, many casinos that don't have smoke-free policies in the past. And a lot of casinos really appreciate this because they want to be able to gauge their own patrons. They want to be able to gauge whether or not their patrons support smoke-free policies within their own casinos. And so, like I said, I've done this many times where I've sent this survey out to a lot of different casinos, and I don't necessarily like ask for the data back. Many times casinos would just put this within like this report, these questions within their own systems, like their player club systems, and survey their guests manually. But the one thing that we do find out by doing these surveys is and by doing like just regional online surveys, not necessarily with patrons, is that a majority of people want smoke-free casinos. You know, they want smoke-free gaming, and this matches the amount of people, you know, that currently don't smoke cigarettes within the United States. You know, the number has been dropping significantly, and so all this data, it just matches to that. People support smoke-free spaces. People support smoke-free casinos, and again, this is just used as a tool to help communicate to your tribal leaders, to help communicate to tribal casinos, to help communicate to tribal coalitions, if you know they're interested in uh, moving towards smoke-free policies, rather than again me going in telling these tribal leaders and how they should operate their casino. I always come from an approach of just bringing in information, just showing like, hey, you know, this is what a lot of tribal communities are saying. And then many times tribal leaders are going to want their own information from their own patrons. And, you know, we have resources where they can kind of put these surveys within their own systems and get that information. So I just want to share again. So I do this work throughout the U.S. I work with a number of tribal coalitions and tribal communities, and our role is really just to support uh, you know, public health, these public health initiatives, and making sure that policies and commercial tobacco control is as successful as possible, whether it's through administering surveys, providing training, a number of different things. We have this conversation with a number of tribal partners every other month through our Reclaim Sacred Tobacco Coalition. We started this coalition in November of 2022. We have like maybe like 50 or 60 people that join regularly. And then this is just a space for people that are doing this work. If you're interested in working with tribes, if you're interested in doing a survey, if you're interested in, you know, working on smoke-free casino work, this is a good place to come and just meet people that are doing this work in California, in New Mexico, in New York, Wisconsin. All people from all over join this call, and you know, just seek out the support for, you know, ultimately passing policy and then reclaiming our tobacco within our tribal communities. And then this is I wanted to leave some time for questions. This is a QR code if you guys want to use your phone, or if you want to follow the link, tiny URL, Reclaim Tobacco. This will take you to a registration site, and you will be then be able to register for the next call, which is May 16th. Sorry, I tried to go over that super fast too, and I hope my thing was just to show you guys some of the things that we can do to be respectful in communicating with tribes. And again, data collection and doing surveys is something that I find pretty useful and productive.
Thank you so much, Clinton. I agree with you, and I appreciate you sharing all that. I just want to do a few questions. I think what we might do, we have kind of a few questions lined up, and what we might do is just schedule a part 2 so that we can have a longer discussion. Because I feel like there's probably going to be more and more questions. But I want to do a few questions before we hop off here since we have a few minutes left. And I will be looking at the Q&A too to see if there's additional questions. But the first thing I just want to start with is, how can tribal partners be allies, or non-tribal partners be allies in this work? That can be for anyone.
Well, I think I tried to share it as simple as possible. I think it's just listening to tribal communities, and you know, before you reach out to a tribal community, do your research and, you know, figure out where the community is, what kind of leadership it has, doing research on the culture, the history, the sovereignty, figuring out, how many casinos are smoke free and things like that, and just doing your research and then if you proceed from there and wanting to reach out to the tribe, I think that will really reflect that you've done your research when you communicate with people, and just listening to what they need, what their stories are, and what their approach is to commercial tobacco control or to policy work or whatever it is that you're wanting to do with the tribe. It's always just about listening, I think, and making yourself available.
Clinton, would you suggest a point of contact? Many times I find folks when we say to contact or reach out to a tribe, sometimes folks don't know where to start. Is there maybe for this issue, would it be like their health department or clinic or?
Olin,
Yeah,
oh sorry, Olin, I think your mic isn't down, so we can't hear you very good. But I think the question was, who's the point of contact that you should maybe try to consider when reaching out to tribes?
well,
Right,
I
right.
mean, yeah, depending on what the issue is, if it's specifically commercial tobacco control, then yeah, maybe look to see if the tribe has like community health representative. I always look for the coalitions, like, because that's where all the work is going to get done. That's where the key, like the heart of the community is at, is through their coalitions. Whether they focus on commercial tobacco issues or not, a lot of times they're working on public health or wellness issues. And so reaching out to the coalition, just asking, if you could attend one, whether it's online or in person.
Let's add to, hi everyone, Colin Welker with Public Health Law Center. Just to echo what Clinton said, as a non-native organization, PHLC, I think we found successful just showing up, being there in person, building those relationships is really important. But again, making sure that we let the community lead the work. And listen to where they are in their stage of readiness for change. Another thing, I think, to answer the question you asked, Natalie, about non-tribal partners being allies is if you can provide funding or just your time to help with these things like data collection, I think that's super important as well.
I'm gonna jump in here real quick too, just to also a lot of our tribes in California and across the nation are looking at capacity building activities. So if you are offering a service or a training or something that comes from your background that you can offer to our tribal health staff, to our tribal projects, letting them, gain skills or gain knowledge, those kinds of things are really important for our communities. So offering that advice, coming to the table with something to offer that partnership is always a great way to start, because for years tribes have often been the receiving end of taking from our culture. So if you're willing to step in and provide training or service, or you can provide our communities with something, we're more willing to open that dialogue and work with you.
That's really great reminder too, Nicole. Thank you. I just want to ask, I think, one more question, which is one that comes up a lot and, can anticipate in the space, which is how do you balance when you're having this conversation? How do you think about and balance tribal economic interests and especially around like commercial tobacco, and then with the interests of the health and the employees, the health of the employees and the patrons and the elders and things like that? Which is, a difficult question. So I don't want to downplay that that's an easy question. Sorry, Clint.
I'll let Olin take that one.
Well, what I approach folks on this topic, I'm very careful to notice if they retail tobacco products, maybe in their casino, or they have a gas station or even a smoke shop. And I am very careful to establish a difference between being interested in health rate of tribal members versus the not touching the subsistence funding created for that tribe by tobacco retailing. And that's my entry point. Now, where it goes from there, maybe depends on who I'm talking to at the tribal level. If I'm talking to some of the health folks, then I can focus on maybe removing tobacco from shared spaces like housing or offices. If they're open to talking about the casino floor being smokeless, I can take it there. But I'm very careful about where I put my foot down, and I always distinguish between a health interest and being and not touching that subsistence funding that they rely on, because honestly, sometimes those tribes will retail tobacco products, and it puts food on the table, and it's
Yeah, they make a
difficult.
lot of money.
It's difficult to have a conversation with folks that when you say, "Well, I want you to stop making money to feed your children," you don't get very far like that. So I think you just have to gauge it and try to determine. But I think the best place to start is with health.
I think that's why the data collection is so important. Hey, Clinton, I mean, it seems like the executives or the gaming officials really care about of course, that they care about the bottom line, but there's also those things to consider, like I think ANR has some great resources about, reduce costs of insurance, healthcare coverage for employees, reduce fire risk. Those types of things too are things maybe they're not thinking about that can come into play when choosing to make the casino smoke free.
Yeah, exactly.
Well, I think I'm gonna stop it there, but we will send out an email blast with the follow-up information, the recording, and also figuring out part 2. So we can continue to have this conversation and have more questions. I just wanted to let people know about our resources. We have a couple of resources on our website. I'll put the links in the chat. And also, Anais, I think, reminded you as well, but I'm going to put the webinar survey link in the chat too. If people have time to do the webinar survey, that would be super great. Anything left? I just want to thank everyone who participated, and especially Olin and Clinton and Colin and Nicole for your time and care on this topic.
Thank you.
My pleasure. My pleasure. Happy to be here.
Bye.